This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hey, Rational Wellness Podcasters. Thank you for joining me again today. And for those of us who have a curious and open-minded intellectual curiosity about the science behind medicine, we have an absolutely fascinating topic, something that is not discussed very often. We are going to be talking about the cutting edge of therapy, something called helminth therapy. What this means, to put it frankly, is purposely eating worms that will grow in your intestines in order to improve your health. I know this may sound completely crazy, but recall when we first discovered that bacteria were the cause of death and disease in the 1800s. And we could prevent disease by killing all these bacteria with antibiotics and antibacterial soaps and cleansers and using modern hygienic methods of toilets and refrigerators and water treatments to clean the water, chlorine, pesticides. And it wasn't until the 1990s that we realized that there are actually beneficial bacteria growing in us, in our colon, in the rest of our intestinal tract, in our skin, in our mouth, in our mucous membranes. And then we realized that by eating live bacteria, yes, those of us who are eating probiotics are eating live bacteria, that these can promote our health. And consider that humans developed naturally with not only bacteria, but also fungi, worms, and even protozoans that lived in our bodies. And today we know that one of the issues about our health is that we have a loss of the diversity of species in our microbiome. We don't have as many different varieties of bacteria. Some species have been completely wiped out. And this is partially because we live in such a clean, sterile environment compared to our ancestors. And this lack of exposure to pathogens like bacteria, fungi, even worms, has led our immune system to become dysregulated, to not have anything to do, but at times to start attacking our own tissue due to a mechanism called molecular mimicry, meaning that our immune system attacks proteins in our body that resemble proteins found in pathogens. The analogy is sometimes used to describe the immune system of a teenager left home alone with nothing to do. It'll find something stupid to do. So without bacteria, fungi, viruses, and worms to attack, our immune system ends up attacking ourselves. We will be speaking with Duke University professor, Dr. William Parker, and he is one of the world's leading experts on helminth therapy, and he studies immune dysfunction and evolutionary mismatch at Duke University. Dr. Parker, thank you so much for joining us today.
It's a pleasure to be here, and I enjoyed hearing your introduction there. So I think my most often quoted statement is about the teenagers. It comes from working with scouts for about 30 years, plus working on the immune system.
Yeah. And, you know, we've heard a lot about molecular mimicry as a cause of immune dysfunction. Dr. Vashtani is one of our friends, and he's written a lot about that. And they have ways to test for some of these molecular mimicry antigens, et cetera. How did you get interested in helminth therapy?
Well, it's back in the day we were working pretty much on the microbe end of things. So we're looking at, for the most part, bacteria, the microbiota. So, and by definition, the microbiota is only the microscopic organisms. The helminths really are not by definition part of that. And in Western society, we really don't think about it. So we were working on the microbiota before it was called the microbiota, back when we just talked about the gut bacteria or gut flora. And we figured out that the immune system was supporting the gut flora, and that eventually led us to figure out what the human appendix does as a safe house for beneficial bacteria. And that's still today, that's probably what my lab is best known for, is figuring that out. But then we're interested in disease, of course. I'm at a medical center. We're interested, especially in inflammatory bowel disease. And one of the things that I thought about was, well, our models are laboratory rats. But laboratory rats really aren't normal. And we knew from looking at the appendix that something has gone wrong with modern society, that the appendix just gets inflamed for no reason in a large percent of the population and has to be taken out. So it's kind of a little mini form of an inflammatory bowel disease in a way. You could look at it that way. And we also knew, again, from looking at the appendix, that these things just don't happen outside of modern society. If you go back and look at through history, if appendicitis was an ancient disease, not just a modern disease, if it was ancient, you would see in the history books, the curse of God, or some horrible curse, and the pain starts, at this certain spot, and then you have a 50% chance of death. But you can't find anything like that in the history books. And in fact, when you start reading history, you'll see that surgeons in the late 1800s were very interested in why are we suddenly having so much appendicitis? So that we know about when appendicitis came on the scene. And of course, one thing led to another. We have a good cure, quote unquote, cure for appendicitis, which is get rid of the appendix, but much less of a cure for inflammatory bowel disease. So we're very interested in what causes that. And again, you look and it appears that it's a modern disease. So then, of course, we got interested in what's going on with these modern diseases. And there's the hygiene hypothesis idea was evolving at the same time. And we can talk about that in a bit, but it's not about hygiene in modern society. In 1920, it was probably about hygiene, but right now it's not. And like I said, we should definitely go back and pick up that thread. But what happened was that we thought about our rat models, our animal models, that our laboratory animals have this disease we have to induce. What about wild rats? They should be more like our hunter-gatherer ancestors. Let's look at our wild rats and let's see how their immune systems work. And what we found was vast differences in everything from how antibodies are made, to complement is made, to all the different cells in the immune system, things that you've talked about a lot on your podcast. Essentially every component of the immune system that you can imagine was different in a wild rat than in a laboratory rat. And we've recently completed studies of taking lab rats and putting them back into the wild. So we can, to a large extent, eliminate issues such as genetics and diet and behavior and so forth and narrow it down to environmental causes. And of course, one of the big differences in the environment is not necessarily in the microbiota. The microbiome, as it's often called, or the microbiota, which is the microorganisms. Those are mostly affected by diet, interestingly enough. And Jeffrey Gordon has done a tremendous amount of work on that. And you can look at the changes for the average person, not to someone who's very sick, and discover that pretty much it's our diet that's affecting the microbiota, but other things have completely washed out most of the complex eukaryotic symbionts, or in other words, our protozoans and our helminths, or intestinal worms.
And so inflammatory bowel disorders like ulcerative colitis and Crohn's, these are very difficult conditions to treat. Patients often have inflamed, ulcerated mucosa in their intestines, but it sounds like, and from what some of the studies I've seen, these are conditions that worm therapy may be able to have some benefit for.
Well, so the answer is we believe so, but it's not proven. And I probably need to if I have a minute here, I can just tell you what we know about that, especially with ulcerative colitis and Crohn's
Yeah,
colitis.
that would be great.
Okay, so Joel Weinstock back in 1999, back in the day, was looking at the effects of helminths on these diseases of the bowel, these inflammatory bowel diseases. And what he found was that the patients who were having tremendous difficulty with, pharmaceuticals, they just weren't responding well. They were responding extremely well to a certain organism, the porcine whipworm, which in the therapeutic stage of that, we just abbreviated as TSO. So this porcine whipworm, or also known as TSO, if you look on the web, you'll see it there. He found that it was really working well. He tested and he published papers 2005, 2007, looking at both Crohn's and ulcerative colitis, and found this TSO, porcine whipworm, to be effective. And you can still buy that worm today. It's produced in Thailand by some of the same individuals. Detlef Ghosh runs the company, who were working with Joel at that time. So what happened next is and a lot of people are, especially in industry, know about this, is they spent millions, tens of millions of dollars developing this. And when they got to phase 2 clinical trials, it just did not work very well. So something happened between what Joel initially did and the phase 2 clinical trials. In tracking that down, what we found is they just changed the formula of the worm. And we have good evidence that these things are, they're different than, say, a standard pharmaceutical in several regards. So first of all is you could think of them as exercise for the immune system. So they're not a drug, they don't kick in immediately, they don't have a specific target. They probably have multiple targets on the immune spectrum, which is part of the reason why wild rats have such wildly different immune systems than laboratory rats do. So that's one issue. Secondly, since they're not a chemical, how you produce them matters. So if you change the pH or the acidity at which you store them in, they're just not the same organism anymore. And what we found from our socio-medical studies, and we'll talk about that in a little bit, but we've talked and collected cases of over 1,000 people using worms. Probably about 20% of all the people that have ever tried worms, we've assessed their reported outcomes. And sometimes it's patient reported, and sometimes it's reported to us by a functional medicine physician who's treating a patient who has decided to use the worms. So when we put all that together, it really looks like, from when Joel did the studies to when the studies went to trial, they just changed the formula. The organism that they sell out of Thailand now, which ships worldwide, it's an extremely stable organism. It still works as far as we can tell, and patients are, they're not patients technically, they're individuals who've decided to treat themselves with helminths still find that it does work quite well. Whereas if you change the formula, and there's reasons why the formula was changed, it's complex and we don't have the full story there. We weren't part of those meetings. We're trying to piece together the history of it as best we can. But if you change the formula, it apparently just does not work very well at all.
Well, I think one of the things I find really fascinating is that this helminth therapy fits very well with the functional medicine model. The traditional medical treatment is to give medications like Humira that simply, not to rag on Humira, but basically these are the types of medications that they use that just block the immune system. They're TNF blocking agents. They just dampen down the immune system. And in functional medicine, we're trying to find a way to regulate and balance the immune system. These worms seem to have a similar effect in upregulating T regulatory cells and in regulating or balancing the immune system. So they fit very well with the type of functional medicine model.
Well, I'd say there's a couple of things there that are very interesting. And one is, now, let's talk about vitamin D insufficiency, for example. So when I go to a conference, they'll talk about patients who are vitamin D deficient and how much vitamin D supplementation helps those patients in so many ways: neuropsychiatric function, immune function. We see, I think, based on our studies, patients are getting the same effect from getting their helminths back. And we refer to getting them back because it's something we lost between about 1850 and 1950. And then there's what we call epigenetic effects. So it builds generation after generation. Plus there's other things piling in, the vitamin D deficiency, the chronic psychological stress, and the obesity, the diets, and so on. So all of that piles in. So we see the same effects of giving people their helminths back as doctors typically see from increasing vitamin D levels in people who are deficient. And although I think you get a bigger bang for your buck with the helminths. Now, in the wild rat studies, we didn't actually see much effect on Treg cells. We saw effects all over the place. Macrophages, T cells, B cells, it's everywhere. In modern medicine, because of our work on laboratory rats, we've sort of zeroed in on a T regulatory cell. And, immunology, modern immunology has a new flavor of the month every few years that comes around, whereas it might be toll-like receptors or the fast ligand or Treg cells and so on. And of course, we're having extreme difficulty treating patients, and immune disease keeps getting worse and worse as we learn more and more about the immune system. And in that regard, the helminth therapy does, I agree, fit perfectly with functional medicine. The main difference is you can't prescribe, you can't give, there's no approved helminth, right? And we can talk about that, but you can buy vitamin D supplements off the shelf. You can go to, a yoga class or take a meditation class or just go get some great exercise that will relieve stress. And you don't have to violate any kinds of rules or regulations, whereas getting these helminths now can be a tricky business.
Right. No, I totally understand that. This is the cutting edge. People are experimenting and taking them themselves.
Right.
So I guess it's not illegal for people to order them online?
No, it's not illegal for people to order them. It's a violation of regulations in the United States only. The United States is the only country on planet Earth where you can't legally ship a helminth for therapeutic purposes. So that's a tricky one. So the companies that are mailing them in the United States are technically violating some kind of regulation. It's not, it's not a federal offense as far as I understand. It's more like speeding or something of that nature. But,
interesting. So there's other autoimmune conditions that helminths are beneficial for. I saw some papers on MS, and you write that for some reason they're especially beneficial for autoimmune conditions that tend to relapse and remit, like forms of MS are.
Right. The major so I think MS. So there's several diseases that achieve notoriety early. So Joel Weinstock, as I mentioned, did studies in inflammatory bowel disease, and then other people have looked at asthma. Some folks have looked at autoimmune diseases such as multiple sclerosis. In 2007, a group from Argentina published a landmark paper. They had about 500 patients with multiple sclerosis, and they knew from studies in animals that if you got a helminth, it might resolve multiple sclerosis. So they just started following their patients and seeing if anybody happened to get a helminth. So they literally accidentally got a helminth. And the 12 patients in the study who did accidentally get a helminth absolutely had no more problems with their multiple sclerosis. And they've done long-term, up to 10 years, beyond 10 years follow-up on those patients. And the ones that keep their helminths have no more multiple sclerosis. If they lose their helminths, then their MS will come back. And it's with the MS that we have the best data looking at different types. So there's some types of multiple sclerosis are very progressive. So once you get them, it just goes forward without any remissions. It just progresses straight on without stopping. And the helminths appear to be only about 40% effective. Or in other words, they only help about 40% of those patients. Whereas with the relapsing remitting MS, you get much more benefit. And we're seeing similar kinds of things with allergies, I think, sifting through the data that if somebody's allergic to mold in their house, they're not getting a break from it, then the helminths don't do a whole lot. Whereas, say, somebody who has seasonal allergies, the helminths seem to be very effective. And in fact, the first report of helminths having a therapeutic effect was by he's retired now, a British parasitologist named John Turton. He treated himself with a bunch of hookworm, and his seasonal allergies went away. His seasonal allergies are incurable, of course, as we know, but apparently not if you count helminths, then that apparently looks like a cure. And we view it as a cure rather than a treatment, just because we view it as exercise for the immune system. So, if your patient has cardiovascular disease and they start exercising and eating right, we don't think of them as taking a pill for their cardiovascular disease. The disease goes away, they're cured as long as they keep exercising and eating healthy, they're cured. So it's the same thing for exercising your immune system. Now, we really think of it as a natural process, that it probably helminths started associating with vertebrates about the time in evolutionary history where T cells and B cells diverged. So looking at 300 million years ago, somewhere in that ballpark. So it's just always been with us, and it's something our immune system needs to just function normally.
Now, I imagine that just like bacteria, there are good and bad bacteria. And the same thing with worms, right? Because I can't get around the idea, when I went to chiropractic college, we took parasitology and we learned about, some of these worms that, you ingest and they crawl through your body and eat away at your liver and your brain and kill you. So obviously, we're not talking about any worm. We're talking about certain specific worms that can have a therapeutic value, but are relatively benign in terms of creating damage to your body. Isn't that right?
Oh, that's absolutely correct. So, about 10,000 years ago, during the agricultural revolution, which happened around the world, as far as we can tell, in many different places, people they developed agriculture, started living in more crowded conditions, and we don't think the worm diversity went up that much, but certainly the number of worms per person may have gone way up. When you move from a hunter-gatherer tribe where you seldom encounter many other humans, and you don't, by the nature of it, you don't encounter other human waste very much. And then you suddenly living in a city where everything is very condensed and just constantly being recycled. So right. And it's subtle. So for example, if we talk about the porcine tapeworm, there we're talking about a very bad, in terms of the way that I think about it, that's a very bad animal. We don't want it around, we don't need it around. It can form a cyst inside the human brain, which has to be removed surgically. It's just not a good critter. Whereas the rat tapeworm, so it's a tapeworm, they're related. One is porcine and one is rat. But the rat tapeworm right now is what we think is probably going forward, one of the best hopes that we have for getting this into the mainstream, getting FDA approval and so forth. So it's just that one little, from pig to rat. And, there's no way to know unless you just know that organism, which one is, where's the salmonella versus where's the lactobacillus, right? It's the same kind of mix. They're both bacteria. In this case, they're both a tapeworm. But yeah, it's a good point on that one, is we don't want just any worm, and that's the beauty of it now. We live in a culture where we can easily control which worms we put back into the population.
Now, is that the TSO worm that you were just talking about?
No, the TSO is the porcine whipworm, not to be confused with the porcine tapeworm.
Okay.
So, and then there was the rat tapeworm, which is the one that we're working on.
Okay.
Right. So let's clear that up real quick.
Okay.
I know it can be incredibly confusing.
Okay. Okay. And then there's also an HDC worm, right?
The HDC is the therapeutic stage of the rat tapeworm.
Oh, I got it.
Right.
So, my understanding is these worms, these TSO, HDC, they come from animals. They'll grow inside us for a period of time, but then they'll die, right?
Yeah, for the most part. I mean, there's some cases of where they'll take off and start growing, but that's mostly benign as far as we can tell. So there are very rare cases, maybe with people with very compromised immune systems, where they might cause severe GI cramping, much as, say, the giant roundworm does. So it's a good worm for therapy, but it's in terms of treating disease, but it's not a good worm for therapy because it causes intestinal cramping. And in fact, those multiple sclerosis patients I mentioned earlier, some of them got the giant roundworm, and it stop their multiple sclerosis, but it just caused too much GI cramping. So, that's a decrease in quality of life, and there you have to
Right.
make a decision. So the
Right.
TSO and the HDC, right, for the majority of people, and maybe the vast majority, you have to keep re-exposing yourself to those once every 10 days for the TSO, once every 3 to 6 weeks for the HDC, just to maintain a certain level of exercise for the immune system.
And those are pretty tiny, right?
Yeah, so if you look at the vials with the TSO in them, you can barely see they're cloudy. So it's similar to a solution of bacteria. They're not as small as bacteria, but you can't just so a single one with the naked eye that you wouldn't be able to see that. With the HDC, it's about a quarter the size of a grain of sand. So they're a little bit bigger than the TSO in terms just starting out. And it's so most people will just take them the way they are. They'll mix them with some kind of milk or something, so you never know they're there.
So this is can be seen as the next level of probiotic, right?
Yes. There's one physician who refers to them as premobiotics. So, I mean, it's, I think we'd like to get them approved as that kind of just a dietary supplement. I think, unfortunately, though, it's going to require legislation for that. The reason why probiotics are approved as supplements is because they've been in the human diet for a long time. Now, these helminths have been in the human diet a long time, but not intentionally in the human diet. So to the regulatory agencies, that makes a difference. So nobody's been, if people in 1910 were eating these worms on purpose, we wouldn't be having this conversation right now. This would already be everywhere, just like a probiotic. But since that didn't happen, since we're just now figuring out what the problem is and trying to do something about it, they're going to have to go through the modern regulatory network. And again, we believe that humans in general need worms, not just any worm, as you said, and not just a huge doses of worm, but we need a certain amount of worms. And eventually, with that in mind, eventually it's going to have to get to the supplement stage. But it's got to go in steps. First, we've got to try to treat the desperately ill, prove efficacy, safety first, then efficacy, and then move on to, less debilitating diseases. This is in the mainstream. Now, of course, people, there's people that are we call it self-treating. They're using the worms, and they'll use it prophylactically. And that's where we think it's eventually getting to, for prevention of mental health problems or migraine headaches or seasonal allergies or the induction of new allergies and so on.
So IBS is another condition that might be amenable to worm therapy?
Yeah, we have some from our socio-medical studies. Again, some people are using it to effectively treat IBS. I think IBS also, chronic stress is a big factor that plays into IBS. And so one of the concerns that we have is that people start thinking of the helminths as a pharmaceutical. And this is my drug, and I'm taking this drug to fix me. But helminths should be viewed as sort of part of a balanced diet, right? You have to deal with other issues. You don't want to be vitamin D deficient with chronic psychological stress and a horrible diet and just say, hey, I'm going to take some helminths, I'll be fine. That is not a good idea. Helminths we call it the deadly five. There's 5 deadly factors in our society that are killing us before our time, and one of those is biota alteration, or the loss of these helminths and protozoans. And of course, the others are diet, sedentary lifestyle, chronic stress, vitamin D deficiency. And then there's a lot that piles in with chronic psychological stress, including sleep alteration that I think you guys have talked about.
Right. So really, it sounds like these be most effective for prevention. And with IBS I think most cases of IBS now are not really caused by stress, but they're more related to a dysbiosis, an imbalance of the bacteria, specifically the small intestinal bacterial overgrowth. And so maybe the helminths help to balance out the microbiome.
Yeah, in our studies in laboratory animal models, we have found profound changes in the microbiota when we put in a helminth. And they look like they're probably beneficial changes. Up to 20% of the total bacteria change. Literally, you before the helminths are in, you have 100 different organisms, and after the helminths go in, you've got 80 of the same, but the 20 are different. And there are, again, differences that we associate with less inflammation. Now, that being said, we think, with the bacteria, there's a lot of chicken and egg question, right? So if your body gets inflamed, we do not view changes in the microbiota as a primary causation of anything, unless it's antibiotic induced. And what we think is going on is that when the body gets inflamed, we know from our studies in the 90s that the immune system and the microbiota work together. So as soon as the immune system gets inflamed, that affects the microbiota. And we've done a lot of work looking at how the microbiota actually change. They actually can evolve in real time. So you give them, if you take a laboratory bacteria and you put it into a germ-free mouse, it'll start living in that mouse, and within 3 months, it will be learning how to live in the mouse, and it will have forgotten how to live in the laboratory. So literally, genetic change and evolution are happening. So when the body gets inflamed because of these 5 primary factors, and biota alteration does include use of antibiotics, but by and large, it's diet, one of the primary 5 that's affecting the microbiota, and then inflammation in turn affects the microbiota.
Perhaps
so it's complicated, and as the microbiota evolves, that has its own set of problems.
Perhaps these helminths have a similar effect to what are called phages, which are viruses that help to balance out the microbiome, specifically by crowding out certain non-beneficial bacteria.
Well, so if you look, we like to think about anthropology and what did hunter-gatherers encounter, right? So in the hunter-gatherer gut environment, there was stability, you have a stable ecosystem that we've lost in modern culture. So, did they have the bacteriophages? Yes. Have we lost those? No, it's hard to say. We're not tracking that data. No, Jeffrey Gordon has looked at the bacteria, and those are affected primarily by diet, but we don't know how our bacteriophages are changing between now and a hunter-gatherer population. We have no reason to believe they're different, but we just don't know too much about it. So again, we like to look at anthropology and say, this is the fish out of water model of disease. So we know that we have these diseases that our hunter-gatherers ancestors did not have. So what are we doing differently, right? And we look at the bacteria as simply another organ. So especially the microbiota is just another organ. So if my heart has a disease, I don't blame the heart. I don't say, wow, my heart is defective. It could be a birth defect, but that's not what we're talking about, right? We're talking about something in our environment is hammering on this organ that we call the microbiota. So again, if the microbiota, we again don't view as a primary sort of inducer we view it more as a victim. Let's put it that way.
Okay.
And that has to do with our thinking back in the 1990s, which was revolutionary at the time. We just got ridiculed for it, that the immune system is actually supporting the microbiota. Now that's widely accepted, and it's the only thing that makes any sense looking at the ecology of the gut, and it's what led us to figure what the appendix does. Without that realization that the appendix, which is full of immune tissue, is helping to support the bacteria, you can't come up with a rational, explanation for why that little structure exists.
So the next topic I'd like to touch on is autism. You've written and talked about how worms can potentially be beneficial for autism, and you've also recently written a paper with a group looking at the connection between acetaminophen or Tylenol intake and autism. Can you talk about that?
Sure, yeah. The idea of looking at autism is something that we really fell into, honestly. So we were interested in worms, we were interested in helminths and how they affect immune function. And when we start interviewing medical doctors who are treating patients, what we find is that many patients with autism are trying helminths, and there's a reason for that, a historical reason why parents who have kids with autism are very willing to try alternative therapies. And that's the bottom line, is that a lot of the data, up to 70% of the data from the HDC, for example, with the rat tapeworm, is from patients with autism. So we fell into that.
Right.
And we started looking at that, but then some aspect, and you ask about the acetaminophen, or paracetamol as it's known in Europe. You ask about that, and what happened was, if you look at the epidemiology of autism as best we can look at it, in my opinion, and it's controversial, what you see is it doesn't quite match it doesn't match hay fever, it doesn't match appendicitis, it doesn't match multiple sclerosis, it doesn't match other types of inflammatory related diseases, and yet we know that autism is associated with inflammation. There's no question, there's a strong connection there. So there's some kind of trigger that came on the picture that started dramatically increasing the incidence about 1980. And it looks like, and our best guess right now is that is acetaminophen exposure from birth to about age 5 or 6. And that's just, it's all happened because of Rye syndrome was associated with use of aspirin. So we automatically switched over to what unfortunately was a drug that had not been tested and shown safe for neurodevelopment.
I recently did an interview with Del Bigtree, and he believes that vaccines are a major factor. And one of the things that happened in 1986 is when they passed the Vaccine Safety Act, which protected the companies that produced the vaccines from any liability. And because of that, there's less of a concern from the company side in terms of proving that the vaccines are absolutely as safe as they can be, because the companies, there's no market forces, typically in our economy. If a company puts out a product that's not that safe, the people will sue. They'll have class action lawsuits. We had airbags, and they put out an airbag that was unsafe, and 3-4 people die, and there's huge lawsuits, and they take the airbags back. They recall hundreds of thousands of airbags and fix them. But in the case of vaccines, these companies are completely shielded from any liability. So there's really no incentive to go the extra mile to make sure the vaccines are safe. And so, and there hasn't been a lot of studies on whether vaccines are connected with autism. And recently there was just a paper published in April out of, I think it was done in Louisiana, Mississippi, and they looked at kids who were vaccinated versus kids who were unvaccinated, and the kids who were vaccinated had 6 times the rate of autism, 7 times the rate of asthma and allergies, and it looks like there's some sort of an overlap here between what's happening with these kids and some of the stuff that you're talking about. And when I watched your video where you were talking about autism being possibly related to Tylenol, you were talking about the fact that you have to have an oxidative stress on the body, which then when you consume acetaminophen at the same time, that is sort of a toxic brew that can lead to damage to the brain, inflammation, swelling of the brain, and potential damage. And one of the things that happens with vaccines is they add these adjuvants like aluminum to get the body to react to the vaccine to make sure you get the proper immune response. And I wonder if the combination of these kids being exposed to substances like aluminum, which metals we know can rust in the body in the presence of oxygen and create oxidative stress, in combination with Tylenol, can be maybe one of the underlying factors in this increase in autism.
Well, so the study you mentioned published in April, of course, that's with homeschooled children. And if you look at the overall incidence of autism, what that proves is that parents with kids who have autism tend to homeschool, assuming that homeschooling doesn't cause autism. So if you look at the actual incidence, the unvaccinated kids do match the national average. So it also shows that probably homeschooling attracts people who don't wish to vaccinate. Now, that being said, as best we can tell, any kind of oxidative stress is going to be, it's going to put a kid more at risk for autism. And again, before 1980, you still had a rate of autism, one in 2,500.
The problem is we haven't had enough studies done. That's my main contention. And one of the problems is kids can't go to public school without getting vaccinated.
Oh, enough studies with vaccination. Yeah, I'm not.
Right.
I'm not an expert on vaccination.
So. Yeah. I don't want to keep harping on that, but I did want to mention one of the reasons they had to use homeschooled kids is that you can't study kids who are going to public schools who are unvaccinated because you're not allowed to.
Right. Okay. So the point is, though, that any kind of oxidative stress, even obesity, it's an independent risk factor associated with a 70% increase in autism. So, and of course, we know obesity is a highly inflammatory state. Fat tissue just produces inflammation. So it doesn't mean that being fat causes autism. Again, we think just looking at the data, and again, we sort of stumbled onto autism by accident. People were interested in biofilms, called biofilms in the gut, and autism, and that's how we initially got into it. Someone working in the field of autism called me up and said, "Hey, you should really look at this." And then we did begin to look at it. And again, the epidemiology is very much unlike a typical autoimmune disease, which would have started accumulating, say, around the early 1900s. So there's something else that doesn't match there. But a lot of the kids, so you can sort of divide kids with autism into two groups. One who has just uncomplicated autism. There's some issue with the brain and they have tremendous problems understanding social situations, and there's a spectrum of that. And then there's also autism with inflammatory comorbidities. So they have digestive disorders, they have other kinds of neurological disorders that are associated with inflammation, and those are the ones who seem to be helped the most by the helminths, as far as we can tell. So even though we're looking at patients with autism that are taking the helminths, we're still finding the same things that we find with the rest of the population. Helminths don't fix the social deficits that people with autism have. Now those, if they're caught very, very early on and they're not severe and inflammation is treated, some kids can at least regain a lot of their social function, and the NIH recognizes that. But by and large, we're looking at older children who are trying the helminthic therapy, and mostly they're treating the same kinds of things that everybody else is treating. They're not. So we want to be careful and not say, "Ooh, helminths are a cure for autism." That is not correct. And I get accused of saying that sometimes by people who don't actually read any of our papers. But that's not what we're saying. We're saying that they have a lot of digestive disorders, for example, much as you talk about on your show. And those are sometimes helped by helminths. And the rough breakdown on that is about 30% of the people see dramatic improvement, about 30% of the people see maybe some improvement and it's questionable, and then 30% of the people just say nothing and see nothing at all. And then there's a few people that have the severe gastrointestinal cramps or might actually get a little bit worse because of the helminths. But the chances of having a very good reaction versus a very bad reaction are probably in the neighborhood of 30-1, somewhere in that ballpark, as best we can tell. But and these are socio-medical studies. There's limitations in how we collect the data. It's not as good as a controlled clinical trial.
Yeah, I suspect the reason why you don't get great results with a big chunk of these kids is because the damage has already been done. I suspect if these helminths if people had been taking these helminths prior to the onset of autism, you probably have a bigger bang for your buck. Like just with these autoimmune conditions, if you can, get these to people maybe just at the beginning stages, maybe there's something you can look at as far as monitoring some level of inflammation or something like that prior to the onset of autism, and you can, balance out the immune system using helminths and a functional medicine approach before there's a lot of this damage done. I suspect you'd have even more benefit.
Yeah, so the interesting thing about that, and especially for the functional medicine doctors out there, I think this is important to keep in mind, is that let's talk about autoimmune disease, or we can talk about cardiovascular disease,
Sure.
At the time when the disease is induced, there's something, the epitope spreading, the thing that really pushes the immune system, maybe an infection that kicks it over the edge, on top of vitamin D deficiency, maybe chronic stress, all these things are piling on, and something kicks it over the edge at some point in time X, in the life history of this individual. The way that the helminths work, as far as we can tell, is initially there is an increase in inflammation. So you have a certain amount of inflammation, you get exposed to a helminth, your immune system says, hey, what's going on? And then you give it a little bit of time, it's a few days, and then the helminths kick in and begin to regulate, and then the immune system drops down to an activity of below. So especially in the animal models, if you induce disease at the exact same time that you give the helminths, you can make things worse. So the idea is, as you said, they're much better as a prevention than a cure, although for relapsing remitting types of conditions, be they allergic or autoimmune or neuropsychiatric, migraine headaches, anxiety disorders, depression, they seem to work great. But at some point, they can cause problems. And the work in animal models has mostly been done in cancer. So if you give a huge hit that induces cancer and the helminths at the same time, you can make it worse. Versus if you give the helminths ahead of time, it's quite preventative.
Right. I think the key is most of these chronic diseases, there's something going on below the surface before the iceberg, rises above the ocean level. So you have this long, gradual, slow increase. And then all of a sudden you get to here and it's like, boom, now you have the autoimmune disease. And you were perfectly fine before, but there was this rising level of inflammation. And if you could intervene in those beginning stages before, you have this fulminating autoimmune disease with damage to the tissues, that would be where you're going to get the biggest bang for your buck, I think. Same thing with intervening with nutrition, with diabetes. You watch the blood sugar, it starts out at 80 and then your fasting blood sugar's at 90 and it's 100 and everything's fine. And, and you just wait, all of a sudden it's 126, bam. Now you have diabetes. How about doing something when it was at 100 or 90,
Right. And the same is true of cardiovascular disease. And my point is, you don't wait until the patient, has 95% blockage and then send them to run a marathon.
Right.
It's not too smart. So if these patients that are very, very sick, some of them have to start out at very low levels of helminths and sort of work their way up, because they're already under a lot of stress. And again, the helminth itself, if it's a perfectly healthy patient, as you said, then that's the time we think to start this kind of treatment. I mean, I hate to use the word even treatment. It should be an exercise immune system.
Right. What speculatively, can you perceive how far in the future do you think we might have studies to really prove this, and this might actually be a therapy that we can utilize?
Well, you talked about financial concerns earlier, and part of the problem is, the market for these helminths, as far as we can tell right now, would be huge. It would be almost every person would probably be interested in these once the studies are done. But the way that the system works right now is the studies are very, very expensive, on the order of tens of millions of dollars. And if I can't protect my intellectual property, right, how do I get my money back?
Right.
So, William Parker, the academician, says, hey, let's go for it, let's do trials. But then, the company person says, well, there's no intellectual property on this, number one. And number two, the trials with that porcine worm, they already bombed out. So I'm not going to touch this with a 10-foot pole.
Right.
So that's where, it's, if you look at the history of the fecal transplant, and it was changing gears for a little bit, but this is the best illustration. It's a beautiful illustration of how financial drivers affect medicine today when you're dealing with the biota. So the fecal transplant, everybody thinks, oh, wow, this is a new thing. It's a great thing. It was nailed down in 1958. That was before we were born. 1958 by a group in Denver, and they knew exactly what was going on. They said, hey, these patients, they've lost their microbiota following these antibiotics. Let's just try to do a transplant from a healthy person. It worked perfectly. They knew the patients were dying at astonishingly high numbers. That was their quote, I believe, without the fecal transplant. So in 1958, it was nailed down, but think about being a physician in 1980. You know the literature, you have a patient that comes in with this deadly disease, recurrent C. diff colitis, and you can give them a pill and send them a bill, and they're likely to die, but it takes 5 minutes and the system makes money, or you can try this fecal transplant, right? But who's going to pay for that? And it takes a tremendous amount of time. And if anything goes wrong, you're liable for it, right? So whereas if you just give them the antibiotics and do the standard of care, if they die from the disease, they didn't die from your treatment, so you're not liable. So you think about the market forces and where they're driving this whole system, it's not a pretty picture. So that's and like I said, I think new legislation will help a lot with that. But first, we need to try to get some trials through that are well designed, just to test to see, do these helminths really work the way we think they will?
Yeah, no, we face the same thing with research on nutrition. If you can't patent vitamin C, who's going to spend, the millions and millions of dollars to run the studies? And the nutritional supplement companies don't have the kind of money that the pharmaceutical companies have. So, the research is not being done on the same level as it is for pharmaceuticals, which can be patented and make billions of dollars.
Right. And fortunately with vitamin C, if you've got a well-educated patient and they can take as much as they like.
Right.
Whereas with the helminths, it just doesn't,
no.
Like you said earlier, you'll eat a can of germs, but because there's a lot of marketing forces behind that, but there's no marketing forces behind eating some worms. So.
Well, this has been a fascinating discussion, Dr. Parker.
I hope you have enjoyed it. And we can definitely talk more about the acetaminophen issue another time if you would.
Okay.
I'm happy to talk about that.
That sounds good. And I'll put some links in the show notes with some of the papers you were talking about and your video on acetaminophen from YouTube. For listeners who'd like to get a hold of you, what's the best way for them to learn more about what you're doing? And
well, of course, we publish all of our work. The most important papers, especially the ones dealing with the self-treatment business, especially for the functional medicine doctors.
Right.
Those are open access online. If somebody needs to get them, I'm happy to send them to you, or my email address is on, it's online. It's on the Duke server.
Okay, so I'll include that in the show notes. What is your email again? Is William?
William.Parker and then the duke.edu.
Right. Great.
Yeah,
it's very generous of you to share that.
Well, it's like I said, it doesn't do any good to hide it because it's in all of my publications, which are in open access. So,
yeah.
The little spam bots get it anyway. It doesn't matter. I just have to, and that does make it challenging, is trying to sort through that and find the emails where somebody has a question. I can't give medical advice. That's not ethical. So I sort through all of the emails and trying to find, okay, this person, I can really help them. They have a question, or I can send them this paper and that's what they're looking for, something like that. So I do try to go through the emails. It's just a challenge sometimes.
That's great. Thank you so much.
Oh, sure. You're very, very welcome.
Dr. Parker. Yep. We'll talk again.